passionate doctor. I'm called 24/7. Dr. Sugar can answer your questions. She's an inspiration.
Hello, I'm Dr. Sugar, your internet doctor, here to continue our discussion on understanding bronchitis. I will go into a lot more detail on the symptoms of bronchitis and what may happen at your doctor's visit. So if you're ready, let's get started with a dose of medical inspiration. Many things around you, like air pollution, certain occupations like coal mining, textile manufacturing, or grain handling, as well as infection and allergies, can all make bronchitis worse. The general symptoms of bronchitis are cough, shortness of breath, especially if your shortness of breath is brought on even by mild activity, wheezing, fatigue, low-grade fever, and an odd chest discomfort. The cough usually produces mucus. Now, it used to be thought that if your mucus was yellow or green in color, that this meant that you are most likely to have a bacterial infection. But most recent studies do not confirm this, so don't get all wrapped up in what color the sputum is. Even after acute bronchitis has cleared, you may have a dry, nagging cough that lingers for several weeks. Additional symptoms of chronic bronchitis include frequent respiratory infections such as colds or flus, ankle, feet, or leg swelling, blue tinged lips due to low oxygen levels. Now remember, these things that I just mentioned, the frequent respiratory infections, the swelling in your ankles, feet, or legs, the blue tinged lips from low levels of oxygen, those symptoms I said were symptoms of chronic bronchitis. Remember, that's the disease that comes on from years and years of smoking or secondhand smoke. That's not the acute bronchitis or chest cold. So we're going to have to keep these two different kinds of bronchitis in mind as we continue through this video series. Okay, symptoms that require a call to your doctor are if you're coughing up blood, you have a high fever or shaking chills, you have a low-grade fever but it lasts for more than 3 days, if you have thick greenish mucus, especially if the mucus has a bad smell to it, yeah, you probably should get in to see the doctor. If you feel short of breath or you have any sort of chest pain or chest discomfort, get in to see the doctor. Or if you have an underlying chronic illness like heart disease or lung disease. And if you have a cough most days of the month, or you have a frequently recurring cough for many weeks at a time. Okay, so you go in to visit your doctor. What's going to happen at the visit? First and foremost, you know your doctor is going to listen to your lungs for any abnormal sounds, and your doctor may order some other tests as well. One of the things they're going to do is going to put the little pulse oximetry on your finger to measure the amount of oxygen in the blood. They may also order some lung function tests or pulmonary function tests where you breathe into a machine as hard and as fast as you can. They may also order arterial blood gas, which is a more exact but more painful and invasive measurement of oxygen and carbon dioxide levels. Now, these arterial blood gases are actual blood measurements taken out of your artery. Now, this is different from your usual blood check that you usually get, which is taken out of a vein. This is an arterial check of the blood, and it is more painful to have that done, just so you're aware of that. Don't be afraid, though. If your doctor needs it, your doctor needs it. Okay, other things that will be done, chest x-ray is very likely. And lastly, sputum samples may be taken to check for evidence of inflammation or bacterial infection. I'm Dr. Sugar, and I want to invite you to join me for part 3 of my medical inspiration video series on understanding bronchitis. In the next section, you will learn a lot more about the treatment of bronchitis and if there is any way to prevent this. So make sure to check it out, and I'll see you there.
Sugar, Dr. Sugar can entertain.